Hello, my name is Scott Howard. I'm a pediatric oncologist. I work at the Hospital Sant Joan de Déu in Barcelona, Spain. And I'm here today to talk to you about antimicrobial resistance in people with cancer. People with cancer have the number one risk is dying of cancer. And of course, this requires lots of different kinds of treatments. The most common treatment is chemotherapy. Chemotherapy is great, works very well for many cancers, but it suppresses the immune system and leads to a high risk of infection. Why do we care about this? Because more and more infections are now resistant to antimicrobials. So antimicrobial resistance, or AMR as we call it, is a big cause of trouble for people with cancer and even takes the lives of some people with cancer. How do we overcome this? We need new antibiotics, we need new antifungals, we need new antivirals, and we need to carefully use the ones we already have, because if we overuse the newest ones, next thing you know, there's resistance to those new ones. But even more important than developing new antibiotics and antivirals and antifungals is making sure that everyone has access to the ones we already have in our hands. For example, aspergillus. It's the black mold that you might see if you live in a humid place like I do. Then you see this black mold in the shower, you see this black mold anywhere there's water or humidity, the black mold grows. That black mold is aspergillus. And it's on the ground, it's in the air, it's sometimes in the walls. And so if you have aspergillus, it's terrible if you don't have cancer. It can cause allergies and sinus troubles, but if you do have cancer, it can be life-threatening. There's a great medicine, voriconazole, that's practically 100% effective for aspergillus. But many countries and many people in some countries don't have access to voriconazole. So for them, aspergillus is an antimicrobial resistant organism, even though if you're in a country with voriconazole, no problem, you just take your voriconazole and get cured. And I shouldn't just say voriconazole, there are many other azole antimicrobials that also work, so I don't mean to promote one over the other because there are many effective ones. But the point is, if you have access, if humans have access to something, we say it's not resistant because there's a treatment for it. But if an individual has access, then that means we can treat that person. So it's one thing to have something exist in the universe that we can use. It's another to have it exist in my hand where I can give it to my patient. And so that's why I hope we'll all pitch in together to eliminate antimicrobial resistance and to manage it when it does occur.